Hello, this is Justine Calderwood, Women's Health Physical Therapist at the Healing Spot Physical Therapy. And I want to teach you a little bit about how to use a small ball for self-treatment. So what I like to recommend is a 4 to 6 inch small inflatable ball. This is just one that I order with my logo on it, and I give to all my new patients when they come in, as well as my students of my online courses. So this little ball works really well to get into those tight or painful areas of your body, areas that you keep tension, your problem areas. I like this one because it can be adjusted, so we can let a little air out or put some in. And I like to have them not be super firm. That way it's got some give when you're using it. So I'm going to give you some ideas on how you can use this ball. I recommend, if you're just starting out, to actually use a nice soft surface like your bed or even a couch. You can do this lying down, face up. You can do it lying down, face down. You can do it sitting in a chair, leaning up against a wall. You can even do it on the floor, but I really recommend starting on a nice soft surface to begin with. That way you're not overdoing it and you can really see what your body likes. If you're a new patient of mine and you're watching this video, you can use the specific recommendations that I gave you during your session on areas to work on, whether that be along the backside into your lower back, between the shoulder blades, up into the neck, or maybe I asked you to lie down on your stomach and work a little bit into the front of the hips, maybe into the shoulder area, or possibly I recommend that you sit on the ball. So I'm just going to show you a couple ways and you can take it from there. The first way that you can use the ball is actually lying down face up. So you can take the ball and let's say you have some lower back pain. Okay, you can find that area by simply feeling around. I recommend that you start out in a nice soft kind of fleshy area into a muscular area versus putting it directly on the spine. But let's say my right side of my low back is bothering me. I can take this ball, I can place it along my lower back, and I can lie on top of it. From there, you can either keep your knees bent or you can straighten them out depending on how that feels to you. So with the ball, the biggest thing is the time factor. So what I mean by that is you want to put the ball into place and then you want to hold a minimum of 3 to 5 minutes. And while you're there, you want to just gently drape your body over the ball and let the ball sink into that area. Alternatively, you can use the ball into other areas. Let's say you have a little bit of tightness in your shoulders and it's causing some discomfort into your shoulder blade area, or maybe leading to some neck pain. So what you can do there is you can actually lie down on your stomach, maybe right at the edge of your bed, and you can put the ball into the front of your shoulder and you can let that shoulder hang over. So again, the time factor is a big element of this, holding for 3 to 5 minutes and letting your body soften over top of the ball. So that is a general rundown of how to use a small ball for some self-treatment. If you have specific concerns or questions, please reach out to me. I'm happy to chat with you about your particular issue that's going on and see if I can offer you some help. I work with people one-on-one in my treatment clinic in Woodland Park, Colorado, as well as Colorado Springs. I also offer video calls, telehealth, and depending on the state that you live in, I may be able to help you in that way as well. So reach out to me and I can look into that for you. I also offer online classes, and I have a class called Release Your Root, and we use the small ball as well as additional stretches, and I show you how to use your hands. It's a very informative class and it's offered online. It's 6 weeks, and I have a self-paced class as well as a live class I teach twice a year. So you feel like you would be interested in working with me a little closer, either one-on-one or in a small group, please reach out to me. Happy to give you more information on those options. Thank you so much for watching this video. I hope it helps you.